Hello, welcome to Stroke Tips. We're going to talk about document stroke types today. NeuroTips is for medical professionals. We provide useful information within a few minutes. There are two main types of stroke: hemorrhagic, that means a bleeding, and ischemic, that's caused by reduced blood flow to some area of the brain. Ischemic stroke can further be divided into thrombosis, embolic, hypoperfusion, other causes, but the cause were known. Cryptogenic, meaning the cause is not known. Ischemic stroke can be divided into the small artery thrombosis and large artery thrombosis. Some of the smaller arteries that were blocked, we call it a small artery stroke. And when the larger artery, such as the middle cerebral artery or internal cerebral artery, was blocked, then we called it a large artery thrombosis. This is another example of a thrombosis of a large artery. The middle cerebral artery is blocked here. When a small artery is blocked, it may cause a lacunar stroke. We call it a small artery thrombosis. And this is an example of an MRI scan of the brain. And on the left-hand side, there's a large artery infarct producing a very large area of stroke. And on the right-hand side is an MRI. It showed two small lacunar infarcts from small artery thrombosis. The next type is embolic stroke. Embolic is usually from the heart or from the aorta. It can be caused by atrial fibrillation, mural thrombus, endocarditis, and right to left shunt. Embolic stroke can be caused by atrial fibrillation. Embolic stroke can also be caused by mural thrombus, endocarditis. Embolic stroke can also be caused by a right to left shunt, such as an atrial septal defect. The next type of stroke is hypoperfusion, that is usually from shock, sepsis, and it may cause watershed zone infarct. This is an MRI scan of the brain. On T2 images, the right areas show a multiple infarcts on both sides of the brain at the watershed zone. The other type of stroke is the other kinds. That is, we know what causes the stroke, but they are classified as other types, including hypercoagulable state, autoimmune disease, or hereditary disorder. The last type of stroke is called cryptogenic. That means the cause of stroke is unknown after the initial tests were done. Well, the important thing is we do have to document the stroke types. And at least document is a small vessel disease, large vessel disease, embolic stroke, hypoperfusion, other types, but cause is unknown, or cryptogenic stroke, that means cause is unknown. Well, thank you again for your attention. We'll see you again soon.